Hi everyone, welcome to my channel. In this video, I will be talking about hypokalemia. In this video, I will be discussing the role of potassium in the body, an overview of hypokalemia, the different causes of hypokalemia, as well as the clinical manifestations and nursing interventions. If you found this video helpful, please give it a like, comment below for any questions, and if you want to see more content, please consider subscribing to my channel. So before we discuss hyperkalemia, it's important to first discuss the different roles that potassium has in the body. Potassium is a major intracellular fluid cation that helps regulate intracellular osmolality, neuromuscular and cardiac function by way of the sodium-potassium pump, as well as regulating acid-base balance. The normal range for potassium is between 3.5 to 5 milliequivalents per liter. It's important to note that sodium and potassium have an inverse relationship, meaning that when there is a high potassium in the blood, sodium is typically low and vice versa. To break down the word hypokalemia, hypo means low, cal denotes potassium, and emia means in the blood, so thus hypokalemia translates to low potassium in the blood. A potassium level less than 3.5 milliequivalents per liter is indicative of hypokalemia. When learning about the different causes of hyperkalemia, such causes may be rooted in potassium loss, a lack of potassium intake, or a shift of potassium into the cells. Fluid loss in the form of either vomiting, diarrhea, or NG suction can lead to hypokalemia, as such fluids are rich in potassium, so when these fluids leave the body, they subsequently decrease the amount of potassium in the body. A diet low in potassium is another obvious cause of hypokalemia due to the lack of intake of potassium. High insulin levels can cause hypokalemia as insulin plays a role in shifting potassium back into the intracellular space. Certain diuretics cause hypokalemia, particularly potassium-wasting diuretics like furosemide or Lasix, so it's important to delineate which diuretics waste potassium and which diuretics conserve potassium. An alkalotic state may predispose patients to hypokalemia as hydrogen ions will shift out into the extracellular space in exchange for potassium back into the intracellular space, thus leading to decreased levels of potassium in the blood. Hyperaldosteronism can also cause hypokalemia. Aldosterone is a hormone that plays a role in reabsorbing sodium in the kidney while excreting potassium via the sodium-potassium pump. So when there is an increase in aldosterone, there is also a subsequent increase in the amount of potassium that leaves the body, ultimately causing hypokalemia. Low levels of magnesium can also cause hypokalemia, as low levels of magnesium causes an increase in renin, leading to an increase in aldosterone, which again ultimately leads to increased excretion of potassium from the body. When it comes to learning the different clinical manifestations of hypokalemia, it's important to remember potassium's important role in cardiac and muscle contraction to better understand what's going on when potassium is out of balance in the body. In a hypokalemic state, you would see changes in the patient's ECG. Such ECG changes include a slightly peaked P wave, a prolonged PR interval, ST depression, a shallow T wave, and a prominent U wave. Other clinical manifestations like muscle weakness, nausea and vomiting, paralytic ileus, and a weak irregular pulse all tie back to potassium's role in cardiac and smooth muscle contraction. So to correct an imbalance of low potassium, you would want to administer oral or IV potassium via an infusion pump. However, it's very critical to remember to never give potassium as an IV bolus, as this can lead to lethal cardiac dysrhythmias. Also place patients on a cardiac monitor to better regulate ECG changes. Also encourage patients to eat foods that are high in potassium, such as green leafy vegetables, oranges, and strawberries. Assess patients for phlebitis when giving potassium intravenously, as it can be caustic to the veins. Also closely monitor patients' potassium levels, especially in patients taking digoxin, as low levels of potassium can predispose patients to digoxin toxicity. And that is it for the video. If you found this video helpful, please give it a like, comment below, and please consider subscribing for more content.